Our research problem is, what do teachers need to effectively support autistic students? This is an important area in educational research that requires further study. The human rights model of disability values support needs and environmental modifications to achieve equality and inclusion. This model directly aligns with the neurodiversity affirming movement, where individuals are encouraged to embrace their diversity by recognizing strengths and accommodating for differences. Increased rates of diagnosis have been reported as the DSM-5 criteria have evolved and professionals have gained a further understanding of how to identify autism. Due to there now being more students identified as autistic and the aim of inclusive education instead of segregation or exclusion, there is a clear need to address how to effectively support the education system and teachers. This topic area benefits both teachers with prevention of burnout and employment sustainability, and also students with supporting their mental health education and providing inclusive learning opportunities. Whilst engaging in the research, it is evident that there is a wide range of studies for autistic students, but limited research was found on how to assist teachers with best supporting autistic students. Due to increased rates of diagnosis, inclusive education, and neurodiversity affirming movement, there is a clear gap in the research regarding how to best support teachers. Therefore, the research problem that we have identified is the support that teachers require to teach autistic students. This presentation will explore 4 studies through the quantitative, qualitative, and mixed method paradigm.
Article 1 aims to compare the knowledge, misconceptions, and gaps about autism within pre-service teachers and in their first and final year of university. The study is a quantitative research methodology with a cross-sectional design. The study involves 866 pre-service teachers from the University of Valencia in Spain. Results of the study found 4th-year students have higher knowledge and fewer gaps than first-year pre-service teachers. Those who engage in autism-specific training beyond what the university provided had higher levels of knowledge than those who had not, and those who had previous experience in education of autistic children demonstrated more positive outcomes within knowledge and reduction of misconceptions. Article 2 aims to assess the level of knowledge about autism among trainee teachers in one university and explore the relationship between respondents' self-assessed knowledge of autism and that of what was demonstrated within the provided assessment. This is a qualitative cross-sectional design with bivariate analysis of key variables. Results of this study identified trainee teachers demonstrated high levels of knowledge about basic autistic characteristics. It also indicated a positive shift in autism awareness among trainee teachers. Those with personal connections to autism were identified to have a higher score on the AAS than those without.
Article 3 investigated the perspectives of teachers in managing behaviour of autistic students through a qualitative and inductive design. 10 teachers with experience with autistic students were selected through a snowballing approach and then interviewed through semi-structured questions with results analysed through thematic analysis. Results of this study identified barriers with teachers misunderstanding behaviour, minimal communication, and negative school administration. Supports were identified as professional development, supportive leadership, and communicating using the same technology. So Article 4 aimed to examine what teachers identified as their most pressing need when teaching autistic students. The methodology of this study was qual-quantological, mixed methods through a Q methodology with 43 participants from Dutch schools ranking 50 statements on their perceived importance. Results of this study indicated 4 different viewpoints as detailed in the PowerPoint slide.
Article 1 and 2 contribute to our research problem by addressing the gap in the research of what student teachers know about autism and how this affects their confidence in teaching autistic students. I'd like to address these studies separately to reduce confusion. Article 1 differed from Article 2 as it studied university students in both their first year and final year of university, making it a longitudinal study and at least superficially strengthening its rigour. However, a limitation of this study is the fact that it included first-year students who had not had any training regarding autism yet, introducing a confounding variable. In addition, the authors admit that the self-report measure used is not considered to have great generalizability and that their sample size is small. However, it did shed light on addressing our research problem. Interestingly, the students had incorrect misconceptions about autism, confirming that evidence-based practice is critical in optimising outcomes for autistic students. Their findings that student teachers in special education programs had more knowledge than teachers in general primary education programs contributes to our research problem in that all teachers must receive specialised education programs about autism. Without this, they lack confidence, which then decreases their willingness to teach autistic students. Article 2. A strength of this study is it being the largest sample of trainee teachers at the date of publication, lending itself to generalisability of its findings. A further strength is the use of the tool called the Autism Awareness Survey, which is an updated version of an empirical, well-validated tool called Autism Knowledge Survey, which has previously and consistently been shown to have adequate internal consistency, stable reliability, and showed initial reasonable validity. The authors note that given that this scale is based on the diagnostic criteria in the DSM-5, it may not accurately reflect the most recent understandings of the salient features identified by autistics themselves, which was an identified limitation for this cohort of student teachers. Inversely, we also deduced that this could be a limitation for using this scale with experienced teachers who have not had as much exposure to the uptick in the neurofirming movement in social media, affecting this study's generalizability. However, the data in this study replicates the second and third other largest studies by numbers of participants with respect to interventions for autistic children, strengthening its rigour. Additionally, instruments such as the AAS do not tell the whole story and neglect professionals' knowledge of practical strategies and lived experiences of autistic people. This was reflected in the data with those who had direct connection to an autistic person. However, those participants, funnily enough, did not answer questions about autism with any higher scores than the rest of the participants. They did have higher levels of confidence than those without personal experience, though. This finding confirms that, despite personal or professional experience, any implementation of practical strategies or education for teachers must be evidence-based. The data also found that these student teachers tended to underestimate their level of knowledge. This finding is a welcome sign that the teachers of tomorrow understand some of the basic diagnostic information related to autism and its implication for children, families, and learning, which relates to our research problem, identifying the needs of teachers wanting to increase their confidence levels. The third article contributed to our research problem by studying the physical and mental load that challenging behaviours some autistic students can have on the teacher, and the consequential effects on their level of burnout, which affects attrition rates. A limitation of this study is its very small participant number of only 10 teachers, the use of snowballing to recruit participants, and the fact that participants were those who worked within either segregated special schools or mainstream schools, with huge varying degrees in the number of students that teachers had in their classroom, as well as the level of each student's individual support needs. Excuse me. The authors acknowledge the impact this had on the strength of their research. These factors affected its rigour and generalisability, as well as introduced unaccounted for variables and bias into the data that could have skewed the results. Despite the authors' attempts, to bolster rigour and interreliability by continuous peer engagement feedback. Despite this, the findings did provide important themes to contribute to our research problem, as participants have had to have at least 5 years' experience working with students, which attempts to address the gap we found on long-term attrition rates of teachers over the course of their career. For instance, their findings that teachers felt they required support from an organisational level to make them sustainable can assist schools in the development of policies and procedures, but also in regards with teachers' needs around education, in that it be continuous, practical, functional, and contextual in order for them to feel confident. The teachers also identified that they required flexible and confident leadership teams with higher support needs students, which could and should influence funding from a government level in the future. We hope that this study's findings that teachers require some time in their day to reflect on their practice, which can promote their well-being, may prompt those organisational bodies to consider creative ways in which to decrease attrition rates in teachers. The fourth and final article contributed to our research problem as it directly addressed it, but it also went a step further by grouping the needs of teachers with their demographics and compared and contrasted them. The limitations included the convenient sampling technique and that some of the participants were not qualified teachers, but rather social workers. This added a fourth identifiable theme that only they aligned with, skewing the data. This study used Q methodology, and the author strengthened this choice by supplying the information on how they derived their Q set, or the questions they asked, and the types of analyses they performed. This study's findings reconfirm the other research about our research problem, including collaboration from colleagues, school policies, parents and colleagues, identifying the need for further education and/or specific practical tips, and that those who were not confident preferred consulting with a specialist to respond to behaviour they found challenging. There were 7 participants who did not fit within the 4-factor model. This indicated that the individual teacher's needs were as unique and individual as the autistic student's needs, which highlights that teachers are people too, with their own needs and learning styles, which can affect the outcomes of their autistic students.
Translation of this research problem with reference to the discussed articles allows for consideration within professional context to occur. Opportunities for translation of these findings include improving teacher training with regards to understanding of autism. All studies highlighted the need for additional training to enhance teacher knowledge and understanding of autism, presenting educational institutions and policymakers with opportunities to prioritise programs that support learning with teacher training qualifications. Increased support for teachers to provide inclusive education practices to support neurodiversity and creating inclusive learning environments for autistic students. This can lead to improved educational outcomes, job satisfaction, and improved overall well-being for autistic students and fostering student-teacher relationships. Practical strategy development with regards to identification of autistic characteristics within early intervention and promoting inclusive education through utilisation of evidence-based practices, as well as future research direction with misconceptions of autism within teaching sector and exploring developments to support positive relationships and outcomes for neurodivergent students and their teachers. Possible challenges in which may arise through translation of this research into professional context include potential resource constraints limited by funding, time, expertise within educational settings to implement training and programs, resistance to change and implementation of new programs within existing educational systems and cultures, barriers associated with creating change within training curricula and navigating policy, and finally, complexity of each individual student's needs, which may provide challenges with regards to personalised approaches being implemented within the broader scale. Thank you.